Baptist Memorial Healthcare, St. Francis Healthcare, and Acadia Healthcare have united to build Crestwyn, a behavioral health and psychiatric hospital that will be located in Germantown. Here to talk about what the facility will offer and what is needed is Zach Chandler. Welcome.
Thank you.
Show.
Appreciate it.
All right, Zach, this is the first time I heard about this. You're the Executive Vice President and Chief Strategy Officer?
Correct.
Wow. Your envelopes must be that long or something. Well, tell me about this new hospital.
Well, certainly, no, we're very, very excited about this, and it's been something we've been working on for several years now. And one of the issues that we oftentimes see really on an almost daily basis are patients that have mental health illnesses or issues and are not able to go and get the care that they need because there's not enough access here in this community of Memphis and really the entire Mid-South region. So we began work about 2 years ago to build what has become today the new Crestwyn Behavioral Health Hospital. It'll be located at the corner of Winchester and Forest Hill Irene in Germantown, Tennessee. It's a 60-bed hospital, and it'll be specifically designed for inpatient care for patients that are in need of either treatment for addiction. It'll offer services for adolescents. It'll offer services for geriatric patients and also adults. So really covering the full gamut of inpatient behavioral health services. We'll be excited to offer that here.
Well, that sounds exciting. I tell you what strikes me is different hospitals cooperating together for this facility. You got St. Francis, you got Acadia and Baptist. So how did that all come to pass?
Great question. And for Baptist, for obviously 103 years now, we have been involved in providing really acute care, medical care. But we are learning more and more about the need for mental health services and how much in partnership or correlation there is between mental health needs and physical medicine needs. And so we reached out and working with Acadia, who is a national provider for behavioral health services. They have over 220 hospitals across the country. And so being able to bring in a true expert in behavioral health care was very important to Baptist. We offer the quality of services that really our patients need and have that expertise right here in Memphis. So the partnership Acadia was very, very natural and just a great fit. And as we began planning for the hospital, we recognized the need of bringing in an additional partner, and that was St. Francis. Very pleased is ultimately how it came together as they contributed licensed beds that allowed us to be able to help build the facility. Baptist donated land, and Acadia brings together the true expertise of managing behavioral health services.
Now, explain to me, is this an inpatient hospital for people to be admitted, or
Yes.
is there outpatient care as well?
Yes, it's an inpatient hospital, and these are designed around patients who need really intensive care needs. So when you think about mental illnesses and mental health needs, you think about illnesses that affect your mood, that affect your behavior, that affect your thinking, and ultimately cause you to have challenges just in life, whether it be in relationships, whether it be in work, and just your daily functioning and daily life. It's very sad to see as we look at statistics across the state of Tennessee that in essence 1 in 5 Tennesseans has a mental health illness every single year. Unfortunately, over 60% of those never receive treatment and care. Now, treatment and care can involve both medicines, prescriptions, as you look at some of the chemical aspects of the brain and how it is functioning, that the psychiatrist can be involved with and prescribing those medications or their primary care physician. But also as they partner together with psychologists and look at counseling. For many of these patients, they need more intensive services than you can receive just on an outpatient basis. And it may be a situation for that geriatric patient that because of the medications they're on, it may take them about 10 or 12 days to get the dosages exactly right. And ultimately what we're here for in this is really healing. And I think about just the mission of Baptist of preaching, teaching, and healing, and how these really work hand in hand together, that you're healing the total health of the individual, both physically and mentally.
You hit on a real good point, because a lot of people, when it comes to mental health, they think that all you need is a pill.
Yes,
a pill will fix it.
That's right.
And there is a chemical imbalance, and there is a place for medication, but counseling and caring and confirming people, I think, is also important as well. And it sounds like that's exactly the mission of this hospital.
That's absolutely correct. You know, as Baptists, we have begun investing in the last few years more and more into mental health services. And I think about the recent addition of the ACE study and really the parenting center that's at Baptist Memorial Hospital for Women, and then also at Knowledge Quest just off of Poplar Avenue, kind of midtown area of Memphis. And that service really came out of a study that was on adverse childhood events. And what they recognized was looking at 10 different conditions or environmental factors that may have occurred in a household that a child experienced. There was a direct correlation, and again, those experiences here real quickly may be things of alcoholism or abuse in the home or a dysfunctional family. It could be something as simple as a divorce. It could be neglect. It could be several things of these 10 items. But what they recognized is what that led to later in life, as the study has gone on for some 20 years now. They have a direct correlation in correlating back to those experiences as a child and now recognizing the person has many medical conditions: heart disease, lung disease, liver disease, cholesterol, hypertension, depression. You see just a list of medical issues that these people face later in life. And
well,
so
as we pointed out earlier in the show, there's a lot of correlation between physical illnesses and mental illness.
That's right.
And also, I think it's important to have early intervention, like what you're saying, to help prevent the consequences down the line. Exactly. Just like we do with diseases, with treating diabetes, to prevent people having heart disease and being on dialysis.
Absolutely correct.
Now, when we talk about mental health, you know, we think about anxiety and depression, but another major topic that I see every day, especially in the geriatric, is dementia.
Yes.
Now, does the hospital address any issues with that?
No, it's a great question. Of course, we're identifying more and more patients that have the issue or dealing with dementia, either a patient themselves or family members. Mm-hmm. One of the things I'm very proud of is over the last year, the Baptist Foundation sponsored support for the creation of the new Memory Assessment Center. And this came out of a study with the University of Memphis when we went out and asked, how do we provide greater care for patients with dementia? And the number one request that came forward was they recognized many of these patients are not accurately diagnosed or don't have a full diagnosis. And so it became critical as we worked with primary care physicians, as we worked with others around the community, caregivers in the community, that we create this memory assessment center for them to go in and have an accurate diagnosis of dementia so that they can get on the right treatment and counseling, whether that be medications, whether it be counseling. What is that support and care network that they need to have around them? We want to make sure we're there for them.
Great. In the last few minutes, tell me how people can access care there now. How do you get plugged into the system?
Great question. For our Memory Care Assessment Center, it's simply going online, contacting that number directly. The visits are free, and we're proud to offer that free to our community of those in need. When it comes to our behavioral health hospital, that will be completed in about April or May of 2016. So it's under construction now. We're looking forward to that being developed and built. But really the primary suggestion I would give to anyone is talk with your primary care provider. Sit down with your physician when it's time for your annual checkup, or even a situation where you may need to go in for something that you suspect you have the flu. If you are having any signs and symptoms of depression, of anxiety, of addictions, talk with your primary care physician, and they're your greatest advocate to help you, guide you through the path of where to seek the best treatment and care.
That's really a good word, and we've had programs here on Health Matters where we talked about people accessing the primary care doctor, sort of the quarterback, to try to help get directed to which way to go. And, you know, as healthcare providers also, we need to be more aware. Yes. And we need to be more diligent about picking up illnesses, mental illnesses with issues with anxiety and depression, because oftentimes people are too embarrassed to talk about it.
Correct.
So I find that it's sometimes good to be kind of proactive and ask some hard questions and try to get the patient to open up, and then that helps me direct them where they need to go and what they need to do. But this is a very exciting venture, especially to see all these entities coming together. Now, you said that's an inpatient hospital, 60 beds, and when do you anticipate possibly having outpatient care there as well?
That's a great question. That'll be coming in really what we call a phase 2. And so as we begin planning for inpatient services, we've got to immediately begin planning for outpatient services. But those will be coming online line we feel like over the next 5 years ahead. Again, just how we work with our primary care physicians and really identifying those patients on the front end, but then two, making sure based on those that we identify, how do we work together and plan the right outpatient services. We still see a great need for that in our community, and Baptist is committed to help provide those services.
Well, this hospital is a great cooperative effort, again, trying to improve the health care, the mental health care in our area. So thank you so much for being here today.
Happy to be here. Thank you.
Next in my Health Matters memo, why mental health is too important to ignore, and a breaking news update. Stay tuned to Health Matters.